What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ToneandTitan.com. In this video, I want to share with you two of my favorite neck exercises that can alleviate your neck pain about as fast as this intro. Pretty quick, am I right? Honestly though, the exercises that I'm about to show you, I have given to patients in the past and they do offer some pretty immediate results. However, it has to be for the right kind of neck pain. I tell people all the time, not all neck pain is created equally, and depending on what's causing your pain, we need to treat that just a little bit differently. And so for the purposes of this video, if you're having joint-related neck pain, arthritis, limited range of motion, if your joint is stuck, if you can only get so far maybe in your rotation or your extension, and you feel a significant amount of pain or a mechanical block at that point, these exercises can be highly effective for you. As always, if you do have any radicular pain or symptoms, meaning if you have any numbness or tingling going on in your arm or shoulder, please go get that checked out. That's not something that we'd want to mess around with at all. That's not something that we can maybe treat here on YouTube. That's something that you would best be served by consulting with a local professional to get exercises that are right for your specific condition. Now, that being said, you guys know me, let's jump into the anatomy lesson to give you a little rundown of why these exercises are going to be effective for you. So here's my spine model, and let's get a zoom in here on the neck. Right now, I turned it around, and so they're actually facing this. The skeleton's actually facing away from you. Zoom in here tight. Now you can see that if I rotate that skeleton's head to the right, that motion occurs at the top vertebrae first, and then the rotation occurs on this top-down kind of segmented motion. The majority of your rotation range of motion is going to come from this upper vertebrae, and so keep that in mind. The other thing that I want to show you with this is as I rotate his neck to the right, or as I rotate his head to the right, which way do those vertebrae move? Now the spinous process, that's this big bony part right here, actually moves to the left. So right rotation, those vertebrae, you can see them moving this direction to the left. And so those are the two things that I want you to keep in mind. The motion usually occurs from the top and comes down, and that whenever we rotate, it's those spinous processes going in the other direction. That becomes important because depending on how far you can move your head, if it's only very little, we know that that problem's a little higher up. However, if you can move a little further until you get to that pain point, we know that that pain is a little bit further down. So now what I want to do is show you a couple of simple stretches, but we're going to preface those with a couple of simple joint mobilizations. I want to mobilize the joint. I want to get it moving the way that it normally should before we stretch. If we can mobilize that joint out of the pain to make the stretching more effective, it's going to be a lot better for you. So let's show you these two exercises right now. For both of these exercises, all that you're going to need is a pillowcase or even a hand towel that's approximately this size. What I want you to do is grab opposite corners. That's going to make that pillowcase as long as possible, and then just put that over your neck or over your head and behind your neck. Now, I mentioned in the introduction here that depending on where that sticky point is or where that pain point happens, it's either going to be higher or lower in your neck. It's important that with this pillowcase, we isolate that point. And so I either want the pillowcase up nice and high on my head, or depending on where that pain point is, I can move it down on my neck. The first thing I want to show you is a mobilization in a rotation motion to your neck. And so, for example, pillowcases around my neck, if I can only rotate my head, let's say I'm going to rotate my head to the left, and let's say I can only go that far before that pain starts to happen, what I want to do is I want to get this towel right on that spinous process, so right on that bony point on the back of my neck, and then help it to rotate further. I'm rotating to the left, that vertebrae needs to rotate to the right. To do that, I'm going to keep this left hand down. With my right hand, I'm on that spinous process on the back of my neck. As I rotate here, I'm just going to push a little further with my hand. And what that's doing is moving that spinous process just a little further. It doesn't need to be a big motion, just needs to be a slight motion, and I'm going to do about 5 or so of those pulses. What you should find is you'll be able to rotate your neck a little further before that pain point hits, and then you're going to repeat that again, about 5 of those little pulses, just trying to get that vertebrae mobilized, just trying to get that joint used to moving without pain again. As soon as we do about 3 sets of that, so I would even do that one more time into that end range, and as soon as we can get a little bit further without that pain response happening, now let's take it into a stretch for your neck. To do that, you're going to let go of the pillowcase, you're going to cross your arms, and then you're going to grab the pillowcase again. With my right hand, I'm going to keep that right against my chest. Now I'm going to use my left hand to pull kind of across my cheekbone in this rotation motion. As I pull my left hand kind of away and behind my body, you're going to feel a great stretch right in the back, right in the neck, in that area where you just mobilized. What I tell people is to hold that for about a 20-second count and then release it, and then you're going to repeat that 3 times. And so that is your rotation mobilization and stretch series that I'd like you to go through. You can repeat this series 3, 4, and even up to 5 times a day. So we talked about rotation. That's probably the primary limitation that I typically see with neck pain. The second one that most people complain about is extension, meaning the ability to look up. I look up and it's pain, it's sharp, it's stabbing. I can't look up without pain in my neck. Those are the types of reports that I get from patients, and those are the types of things that I want to show you how to work your way out of right now. We're going to grab our pillowcase again. The other thing that I've changed up is I've got a chair here, and you'll notice that it's a sturdy chair. I don't want it to pivot or swivel or anything, and then it's also got a relatively low back on it. I don't want it to be super high up on my shoulder blades because I'm going to want to be able to extend back over it. Still got my pillowcase, it's still folded at the corners, and I'm gonna go up right over my neck again. So the same test applies here. As I extend back, if I'm stuck about right there, what I wanna do is get that pillowcase up right on that level where it tends to be sticky. Now the first thing that we wanna do is just perform some gentle, kind of active range of motion type exercises. You're gonna get that right up on that vertebrae, and you're gonna just hold it right there. So we're right here, and then all you need to do is push. So I'm pushing this way with the towel, just a gentle pressure as I try to look up. So it looks just like that. All you're gonna do is look up, hold, 2, 3, and down. Up and hold, 2, 3, and down. And what you should find is that as you continue to perform this motion about 5 or so times, you should be able to look up a little higher each time that you go up. Now, as you get higher and higher, we want to continue to mobilize that neck and promote that extension. We're going to do that through the neck as well as through the upper back with the chair. So I'm right here, I'm right on my spot. I'm going to come up to where I kind of meet that pain point. But now what I can do is with my hands, lift my hands up, so about the level of my eyes are about looking at my hands. Right here, I'm going to come up and then I'm going to lift just like this to extend further into that extension motion. Because you can apply that traction force and that lifting force, oftentimes that's enough to eliminate that pain response and help you into that further range of motion. You can then take this even one step further and extend back over the chair. It really helps your thoracic spine and your posture to get to where they need to be. And so that full thing would look just like this. We're right here, I'm going to extend back with my neck, I'm going to extend up with my hands, and then I'm going to extend back and over the chair just until a comfortable stretch is felt, and then hold that for about 5 seconds, and then come back down out of it. So we're going to come up, hold here, extend back, lift over the chair, hold 1, 2, 3, 4, 5, and it looks just like that. I typically recommend that you perform that one about 10 times, and then like the other exercise that I showed you, you can perform that 3 to 5 times throughout your day. As always, if any of these increase your pain, that's an indication that we're going the wrong direction. I want you to cut them out immediately. And again, it's a good idea to go get it checked out by a local physical therapist or a local professional. So I hope those help you guys out. I hope that helps you out of some of the neck pain or discomfort that you might be experiencing. If it does, do me a favor, hit that thumbs up button. Also, I'd love to see you back here for future videos from Tone and Tighten. If you haven't subscribed to my channel yet, you can do that at this circle button right here. If you're having trouble sleeping with your neck pain, check that video out. That'll help you out. Here's one more for neck pain that you might enjoy. And we'll see you next time right back here on Tone and Tighten.